Many international nurses lose months trying to get a job in the UAE because they follow the wrong process. Some apply for jobs without starting their license, others fail job document verification, and many never get interview calls despite having experience. If you understand the correct step-by-step pathway, you can significantly increase your chances of getting hired in Dubai or Abu Dhabi much faster. The UAE is one of the most attractive destinations for nurses worldwide due to tax-free salaries, modern hospitals, and strong demand for qualified healthcare staff. Healthcare facilities in Dubai and Abu Dhabi follow international standards with advanced equipment and multicultural teams. Another major advantage is career growth, as many nurses start as staff nurses and later progress into senior, specialized, or a role as a supervisor. Before applying for nursing jobs in the UAE, you must meet some essential requirements. You need a recognized nursing degree or diploma from an accredited institution and an active nursing license in your home country. Most employers prefer at least 2 years of clinical experience, especially in hospital settings such as medical wards, ICU, emergency, or surgical departments. Good English communication is also very important because patient documentation and team communication are mainly conducted in English. The first official step is choosing the correct licensing authority based on where you want to work. If you plan to work in Dubai, you must apply through the DHA, which is the Dubai Health Authority. For Abu Dhabi, the licensing body is DOH, the Department of Health. For other emirates like Sharjah, Ajman, and Fujairah, the authority is MOH. Selecting the correct authority from the beginning prevents delays, repeated fees, and unnecessary complications. After selecting your licensing authority, the next major step is DataFlow verification. This is a mandatory primary source verification process where your degree, license, and work experience are checked directly with the issuing institutions and previous employers. Many applicants get delayed at this stage due to incorrect employment dates, missing documents, or unverifiable experience letters. Accuracy and consistency in your documents are extremely important to avoid long processing delays. Once your DataFlow is approved, you become eligible to take the licensing exam. These exams are computer-based and focus on clinical knowledge, patient safety, and practical nursing scenarios. The exam difficulty is generally manageable for nurses with real clinical experience, especially if they prepare using standard nursing review materials. Passing this exam is a milestone that significantly improves your employability in the UAE healthcare market. A strong and well-structured CV plays a critical role in securing interview calls. Your CV should clearly highlight your clinical experience, department exposure such as ICU, ER, or inpatient wards, and any relevant certifications like BLS or ACLS. Avoid long paragraphs and focus on clear professional formatting with concise bullet points. Recruiters in the UAE often review hundreds of CVs, so clarity and professionalism make a major difference. After starting or completing your licensing process, you can begin applying for nursing jobs. You should apply through hospital career websites, licensed recruitment agencies, LinkedIn, and major UAE job portals. Walk-in interviews are also common in Dubai, particularly for candidates already inside the country. Consistent applications and professional follow-ups greatly increase your chances of getting interview invitations. In 2026, general nurse salaries in the UAE typically range between 5,000 and 9,000 AED per month, depending on experience, hospital type, and specialization. Specialized nurses such as ICU, emergency, and operating theater nurses often receive higher salary packages. Some employers also offer additional benefits like accommodation allowance, health insurance, annual flights, and overtime pay, which increase the total compensation. One of the biggest mistakes nurses make is applying for jobs before starting the licensing process. Hospitals in the UAE usually prioritize candidates who are licensed or already in the verification stage. Other common mistakes include submitting incorrect documents, using poor CV formats, and not understanding DataFlow requirements. Avoiding these mistakes can save months of delays and significantly improve your job prospects. A very important professional tip is to begin your license process before actively applying for jobs. Licensed or exam-eligible nurses are seen as lower-risk hires by hospitals and recruitment agencies. This often leads to faster hiring decisions, more interview opportunities, and sometimes better salary negotiations compared to unlicensed applicants. If you are planning a healthcare career in the UAE, understanding the licensing system and job market strategy is essential for long-term success. This channel provides practical and realistic guidance for doctors, nurses, pharmacists, and other healthcare professionals planning to work in Dubai and Abu Dhabi. Subscribe for more step-by-step videos on licensing, salaries, and healthcare careers in the UAE healthcare system.